Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about.
Hello, everyone, and welcome back to the Reprofiles. I am Elizabeth, and as always, I am joined by my brilliant co-host and dear friend, AnnMarie.
Well, thank you. Hi, everyone. We've had some incredible guests in the past few weeks. Brave people sharing their stories about reproductive health, their fertility journeys, and the realities that come with those choices. So if anybody missed those episodes, definitely go back and give them a listen. It was great having them.
Yeah, we got so much positive feedback on both of those. One was with a young lady named Jess, who bravely shared her story about but telling her own story on Capitol Hill. And that was a really beautiful episode. It got a lot of good feedback on that. And then our guest, Lise Regula, last week, that was wonderful as well. AnnMarie and I will be going to a conference in a couple of weeks where we will get to see Lise. So maybe we can get an in-person picture at that time. But today we're turning the spotlight to something a little bit different. And that is a practical conversation about birth control. You know, there's been a lot of stuff about birth control in the news and in different places. Some of you may be aware that I believe last month, the federal government actually spent $180,000 of your and my hard-earned tax money to burn or incinerate $10 million worth of birth control that had been earmarked for third world countries as a part of USAID. So birth control, unfortunately, is getting swept up into a lot of the ideological and theological quagmires, if you will. And so we want to empower people to make informed choices. AnnMarie, I know you would agree with me, but contraception is a cornerstone of that conversation.
Absolutely.
Right?
And just absolutely. And going back to what you were saying about all that contraceptive that was destroyed, we had mentioned this earlier on an earlier podcast, but that people were trying to obtain it. They were asking for it to be either donated, and there were people that were trying to purchase it, but instead it was destroyed.
Yeah, and then that's exactly why I call it an ideological and theological quagmire, because it makes no sense unless you put that spin on it, right?
It's just, yeah. Well, so this episode, there may be people out there listening right now that are considering birth control, changing methods, or just figuring out how to talk to their teen or other young adult about it. So we got you covered. Pun totally intended.
I knew you would come at me with one of those, at least one of those.
Yeah.
But here's the truth, folks. Here's the truth. People deserve the chance to be educated so that they can be knowledgeable enough to make a choice that fits their lives. So there's a lot of talk from a lot of people without uteruses about ways to not get pregnant. And then if you do, too bad, so sad. And yet we block somebody's ability to choose what fits them, right? So contraception is far from being a one size fits all type of solution. I'll say for me, I cannot use hormonal birth control. I have severe migraines. And if you have migraines and you take your risk of stroke because of birth control is elevated. So there were plenty of times that, in fertility care, in the fertility world, we actually use birth control as a method of sort of timing the ovaries. I can recall many times asking patients, oh, you don't smoke, you don't have high blood pressure, right? You don't have a history of stroke, a history of migraine, right? So it's not a one size fits all. It's about what's finding safe and effective and accessible that works for your needs. That's kind of where I think the truth lies.
Yeah. And I remember just being in the clinic side and seeing like high blood pressure. I'm like, oh my gosh, we have to do like progestin only birth control. Oh my gosh, because I would just get worried because you hear those stories. These young women do have strokes. I mean, it is possible and it does happen. So, it's a tough conversation to talk about birth control in general. everybody carries their different values, their beliefs, their experiences. But, if we can talk about infertility, pregnancy loss, IVF, we can definitely talk about birth control without any shame.
Absolutely. I mean, I think our guest last week, Lise, had mentioned, kids are going to have sex whether you talk to them beforehand about it or not, right? Young
Mm,
adults do what young adults are going to do. And
yep.
you can have the conversation, but you can also equip them with the tools to make good choices. Speaking of shame, you remember that scene in the Addams Family where Wednesday calmly tells the little girl, like, how she say it? My parents
She
had
said, "My parents had sex," because the little girl was talking about, like, how there was a stork and the stork brought diamonds to the Cabbage Patch, and then Wednesday just, deadpans it, "My parents had sex." So,
we all need a little more Wednesday energy in these conversations, wouldn't you say?
yes, absolutely, and it shouldn't be like "Oh, let's tell these fantasy stories." No, leave that for, books or whatever. But, when we're talking about this, we need to tell, children, young adults, teens, we just be open. Just got to talk about it. Just say it, get it done.
Just say it out loud. Just say it out
Yeah.
loud. Say the quiet
Say
part
it
out
out
loud,
loud.
right? Because
Yeah.
listen, because truly, but pretending like babies come from diamonds and cabbage patches honestly does not help anybody make informed health decisions. You and I have had this conversation before about assisting a patient in an embryo transfer, and we need the bladder to be relatively full for an embryo transfer to be done with the most ease possible, right? So the question that almost everybody has when they're doing their embryo transfer is, can I go to the bathroom? Because their bladder is really full. And the folks who didn't get a little more of that Wednesday energy in their conversations, because they'll say like, aren't I going to pee my embryo out? And you're like, no,
Yeah.
no, you're not.
No, honey, no.
Yeah, no. So let's start at one end of the spectrum, right? That's abstinence. And that's, it's 100% effective at preventing pregnancy, but it's not for everyone. It is a valid choice, right? We just said kids, teenagers are going to do what teenagers are going to do.
Hmm.
I think if, not engaging in sex outside of a relationship or whatever your beliefs might be, what I think is the thing that we need to start really trying to talk about more and embrace more is that there's a whole lot of different ways to do a whole lot of different things. And if you don't believe in birth control, as your nurse, I am not here to try to convince you. I am not here to try to convince you to do anything that you are not comfortable doing, right? So 100% effective, but not for everyone, right? So, and I think at the end of the day, we also have to acknowledge that there's a lot of ways to express intimacy that don't involve sexual intercourse. And do we teach those things? I grew up in a family that we had just hugs and, normal affectionate, like that type of affection. But I think that we don't always share with our teenagers some of those things, right? Because we know that they're socially very inept at times, right? So why do we expect them, right? They know that there's this thing, this really big thing where my parents told me to do, and it's this thing called sex, but I can hold hands with my significant other. So there's a lot of ways that involve intimacy. And again, I don't think we talk about them. So I think that they get glossed over, in the broader conversation.
Yeah. Yeah, absolutely. We just move right into the natural or the low tech category, I guess we could call it, of birth control, like the rhythm method, basal body temperature, cervical mucus monitoring, calendar tracking, those types of things. They're all like kind of forms of fertility awareness. The effectiveness is somewhere between 77 and 98%, depending on your consistency and your accuracy. Now, with basal body temperature, you're checking your temperature every single morning before you get out of bed. What if you have a cold? Because, the reason that people do the temperature is because after ovulation, your temperature goes up, right? So you're supposed to be tracking your temperature and then seeing when the timing is right. Or, when not to have intercourse to avoid pregnancy if you're trying to avoid that. Now, cervical mucus monitoring is the same thing. You're checking it every single day. Now, I have to admit that cervical mucus monitoring was very confusing to me because I was like, I don't know what I'm looking for. When I was trying to conceive, I was like, I don't know. Is it different? I don't know. And then I kept hearing these stories like, oh, it's supposed to be really thick and blah, blah, blah. And I'm like,
Kind of giving teenagers a lot of credit, right? Like, because like at the end of the day, like I cater, yeah, it's giving teenagers a lot of credit to really to be able to parse down. Are we talking like egg white, cervical mucus? Are we talking? I mean, come on, really?
yeah.
But I mean,
I mean, I couldn't do it as
ASRM,
an adult.
yeah, exactly. And I mean too, you mentioned the consistency factor, and I really want to say this loudly and clearly. These methods work really well for some people. I know
Absolutely.
plenty of people who have planned and built their families doing methods like these.
Hmm.
Don't I want no make no mistake. Everything we're about to talk about has a place, okay? Because remember, the definition of infertility, if you're under 35, is 12 months of unprotected intercourse without pregnancy. So we don't even call it infertility until you've taken 12 shots at it, right? So
Hmm.
remembering that I think what's important here is that these things, these methods, and ASRM notes this, they require really strict adherence. And I think, especially in a day and age like ours today, I think it's very easy to become distracted. The regular cycle tracking is important, but at the end of the day, you're trying to ask essentially a layperson, not a clinician, not somebody with the training, but you're asking a layperson to be able to interpret subtle patterns.
Hmm.
But as you said, you might end up with a fever. You be under stress about a presentation at work tomorrow. You might have regular sleep. Like all of those things can affect the accuracy of something like basal body temperature or calendar tracking type method of family planning.
And that's not even counting the people who have irregular periods, right? I mean, we're talking like people with PCOS. We're talking about anybody that has any type of irregular periods. This is going to be really difficult to go through them as well.
Yeah, I mean, how many times have we had patients, what is the thing we say to them after we give them their calendar and we say, okay, we say, call us with the first day of your period. And
Hmm.
until I got into fertility nursing, I did not realize how complicated a thing that can be. 'Cause
Yeah.
I would have patients telling me they'd be like, "Elizabeth, I think I started my period." I'm like, "What do you mean you think you did?" "Well, it started and then it stopped, and then it got dark and then it stopped altogether for a day, and now it's kinda back, but it's like." Periods are really complex, right? So there
They
again,
are.
we're asking 14, 15, 16-year-old kids who haven't really even learned the scientific method to be able to
Hmm.
say like, and so like there again, if you have really super regular periods, it can be a lot more useful. But for those whose periods are sparse or sporadic in nature, I feel like you're just asking for a failure.
Yeah. Yeah. Now, some of the one of the other things that has mentioned, and I talked with a good fair amount of people about this topic, and one of the methods, withdrawal method or the pull out method, right? That also falls into this category, and some couples use it successfully, but being that we were in the field, we kind of know that pre-ejaculate can contain some sperm, and again, consistency is everything with that.
Absolutely. Yeah, and if you want to plan, if you want to plan your family, like, make sure that the tools you're using allow you to be the most successful at that, right? Where, like you said, if somebody is using the withdrawal method thinking that as long as they withdraw before ejaculation, everything's fine, then it's going to be very disappointing to them when they can't plan the way they thought they could, right? So, okay, so we've got our like natural low tech stuff. Now we have barrier methods, things like the literal blockades between the sperms and the eggs, right? So most people immediately think of condoms.
Yep, condoms are they're about 87% effective with typical use. Now, I always have to stress this because yes, you're going to read that condoms have like 90 blah 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 99% chance, but that's of using it exactly right every single time, but the number is around 87 with typical use. So just that is something to consider as well. Now, one of the pluses of using condoms is it has that reduction of your sexually transmitted disease, right? So that is a very good method, and I think that when I talk with parents, particularly parents that have sons, there are having the condom conversation. I had a parent told me that before their son went off to college, they just bought him a bunch of condoms and was like, had a little bit of talk with them, but was like, here, I'm just going to buy them for you and send you to school with them. Which, I don't know if that message is always going to stick with them, but at least they're setting them up for something like, let's
Yeah,
consider about it.
that conversation in and of itself is truly a win, right?
Hmm.
Because, it's progress. It normalizes responsibility. I think as you and I know all too well in 2025, post the fall of Roe, pregnancy is always considered when it is a problem, it's a woman's problem,
Hmm.
right?
Yeah.
We're the ones that some state legislatures think should go to prison, right? But where is the responsibility aspect of the fact that, if you have sons, that it is incumbent upon you to teach them that, right? So I think that that's sort of this fascinating dichotomy of, well, it's really a double standard because, even a deadbeat dad doesn't get thrown in, I mean, some state legislatures are calling for like life in jail and I mean, just crazy stuff.
Hmm.
But again, having that conversation. I know I didn't get the period talk. So for me, I really wanted to make sure that my girls had a proper period talk. We've talked about this before, right? So, and I think, I'm glad we got to this today with our sons because again, it normalizes responsibility.
Yes, absolutely. And I think it's great being, a mom of daughters as well, is like making sure, hey, make sure that your partner is also wearing a condom. It's not so
Right.
much that our boys, we have to tell the girls as well to make sure that.
Absolutely.
So speaking of female, there, how many people know this still, and it's been around for a while, but the female condom exists too. 79 effective, and they also protect against sexually transmitted diseases. And they really just haven't gained that same popularity as regular condoms. I think it's due to access. Like, you don't really see them on the shelves much at the local drugstore and stuff. And they're also a little bit more difficult to use. I remember the first time, I did work at Planned Parenthood, and the first time I saw a female what is that? I had never seen one before, and this was
Yeah.
only a few years
And you
ago,
were,
right?
yeah, you were a nurse.
Yeah, and I was like, "Oh, this is truly fascinating." So, there's all these different options as well, like male condoms, female condoms, yay.
Yeah, no, absolutely. I mean, and I think that, we've talked about this always, is the choice factor, right? What I think would make for such a harmonious society would be one where we all defend everyone's right to make the choice that's right for them. Because, we've brought it up a few times, but STI protection is really important factor. So there are things that can reduce pregnancy chances, but um that eliminate the STI chances. So
Mhm,
that would be something like a spermicide.
mhm.
They come in different forms and they're about 70% effective on their own, but they're not always well tolerated. And there again, if that's the only method you're using on on that front, you don't do anything to keep your sexually transmitted infection or disease risk down.
Yeah, yeah, and
So
a lot of times those spermicides are used in tandem with condoms and with the next topic, which is the diaphragms and the cervical caps. So a lot of time, that's how you use them. You use them with a spermicide. Diaphragms and cervical caps, we're starting to get into the prescription level type of things. You do need a
yeah,
prescription fitting, they have different sizes depending on if you've ever had a baby or not and all of that stuff. So
seems very
and
personal, Anne
it's
Marie.
very,
It has
yeah,
to have
very
a fitting.
personal. Yeah, it's not
Say
going into
yes
your.
to the cervical cap.
That's a good show. Maybe we can start designing new, like, diaphragms and cervical caps, like, design on them. Oh, and the cases, girl, we got some ideas going on here.
Well, I will say, I know, I've been a women's health nurse for a decade and a half about, and I cannot say that I ever had a patient that for whom that was their chosen method, right? So they have fallen
Yeah.
out of favor, though they are viable options for some people who want or need the non-hormonal options. Right? And then, we can't forget the sponge.
The
Cute
sponge worthy.
cute Elaine and Seinfeld and her sponge-worthy criteria. I mean, it's a real thing though. 78 to 86% effective and available over the
Yeah,
counter, so you don't need a fitting.
yeah. So like that episode aired and the sponge was going away, right? That's why she would have bought like all those cases of sponges because it was going away, and she had to do the interviews with her partners because she wanted to make sure they were sponge worthy. But yeah, it's back, I mean,
It's
it's not very it's yeah. So those are kind of our barrier methods that can be used. So now we're kind of moving up the scale here to more of like hormone, and that's like, the pill, patches, rings, injections, implants, IUDs. So this is where choice meets convenience, because with all the other methods, you kind of have to be on top of it, right? You have to be like, okay, so, you have to keep track of these things, or you have to use them very consistently. And you have to make sure that your diaphragm is in correctly, or your cervical cap is, applied correctly, all of those things. Whereas with the hormonal options, it gives you a little bit more of a, I guess you could say, freedom. You don't have to think about it as much, although each one of them has a different level of reminders of it. So this is where kind of like where my birth control story begins, because I started my first birth control was the pill. So, I was in college and I was like, intimate with my boyfriend, no husband. um I decided to go on the pill. I had to find a gynecologist, and of course I didn't tell my mother. Now my mother's gonna know about this because I'm talking about it right now. But yeah, I did it on my own. I made the appointment. I went, got it the pill. It was very exciting. It was like, oh wow, this is very exciting and nerve wracking at the same time. When I got my wisdom teeth removed, probably about a year or so later, I was in the I was in the meeting, the pre-op with my mother, and they're like, "Okay, now," you know where this is going, right? "So, we're gonna give you antibiotics, and just to let you know that the antibiotics are going to make the birth control pill less effective, so make sure you're using extra protection." I could have died sitting in that dentist chair.
You're actually turning red right now. For those of
Yeah,
you
and my
who only
mother
listen
was
to us, it's worth going to YouTube. Check that moment because you are totally
oh my god. Yeah, so I was just like, and my mom just, I mean, I don't know if she just had an inkling or whatever, but we just ignored it. We didn't talk about it. It was just like a non-conversation, but I could have died. But, another reason why it's good to have this open conversation with younger people so that they don't die in a dentist chair.
right, right. No, I mean, you make such a good point, and I hadn't really thought it through too deeply up until you said it, but this idea that birth control, oral contraception, we'll say OCPs, birth control pills are pretty effective, somewhere around 93%. Again, that's what typical use. It is more convenient in many ways because it's something you can do at a regular time each day. I would always tell our patients, make sure just pick a time that no matter where you are, you can stick with that time each day, because that habit then helps increase the efficacy of the pill to do what you want it to do, in that instance. The birth control pills in general come in two forms. So you had mentioned one earlier, progestin only, and that's the type of birth control pill that you would use for somebody who couldn't use something with estrogen in it. There's also the combined oral contraception with this, which is estrogen and progestin combined. So when I did IVF, because I couldn't do your, combo estrogen progestin, just did the progestin only birth control. But when they are used for contraception, they're also frontline treatments for a lot of different things. Things like we mentioned earlier, if you have irregular cycles, getting on birth control pills can actually really be a huge game changer for you, because all of a sudden your body, which, it was meant to menstruate once every 28 days. So when that's not happening, things build up in the body, and that's where you get things like acne and, all the things, painful periods, right? If you're not having healthy, frequent periods where you shed the endometrial lining of the uterus each month fully, then, sometimes you can end up having pain from that. The birth control pill is, again, it's in the spotlight right now because we've chosen to make reproductive autonomy like a big ordeal. But much like um, abortion, which has, I'm going on a little bit of a tangent now, but I was having this discussion with somebody earlier today. I have a friend who is making me stuffed uteruses to bring to ASRM, AnnMarie. I'm telling
I
you,
love
if those of
this.
you who are listening think you might want to get in on this Nurse Lee stuffed uterus, just make sure you find me at ASRM. But she said something to me. She said, Elizabeth, I was talking to this person in my quilting group, and I was just joking, mentioning that I'm making stuffed uteruses. And she said, for a friend of mine who's a fertility nurse. And the woman said back to her, isn't that quite contradictive with being pro-life?
Wait,
So it was like, so it was this idea that it's getting so twisted because it's like if you're pro-life, why wouldn't I mean pro-life people love babies. We make babies, we bring babies to the world, Henry. That's what we do, right? How is that not
yeah,
pro-life? It
absolutely.
just but she made it clear to me how politicized women's health really in general has become, right? So
Mhm.
abortion, we've talked about it before. Now IVF there's, a war on IVF, and now there's a war on basic birth control. And
Yeah.
just like with abortion, when you outlaw things like mifepristone, you don't just stop people from having elective abortions, you stop people who need mifepristone because their baby. I mean, there's other reasons people need these things, just like there's other reasons people need birth control that aren't for birth control, but it's being blocked because it's all an ideological quagmire.
Yeah, I mean, I can't tell you how many people I've spoken with, they had PCOS or irregular periods or they had painful periods, and birth control basically changed their life, right? And some of them will even say it saved their life because they were able to obtain it. They're taking it for that. It's this is not a controversy. This is making someone's life just better. Another thing about when I would have a patient with PCOS would come in, and they would tell us about their periods. Oh, like it's once a year, or twice a year, or what have you. Have you ever been on birth control? Oh, no, I've never been on before. And then we would do an ultrasound and we would measure their uterine lining. And it was so thick. It would be so, so, so thick. And the first thing we had to do was order them medication so they could shed that lining. That was the most important thing is like you were saying, we were meant to shed that lining. That lining was so thick and that can turn into endometrial cancer. And that is the concern with people who, have this thick lining. They're not ovulating, they're not able to shed that lining. And that's a life-changing thing to be able to have
Yeah,
hormonal help to prevent that potential endometrial cancer. So, hey, whether you go on birth control to help with that, or you every 3 months, you get prescribed a medication to help you shed any type of lining to protect yourself. That is, protecting your life. And I think that's what a lot
absolutely.
of people birth control gets I think a bad rap sometimes from people because they think, oh, we're just doing, it's just going to allow teenagers to have sex. No, it's not. It's used for I mean, yes, it is used to prevent pregnancy. Correct. However, there are so many other reasons for
Yeah.
taking birth control. And you know what? Prevention of pregnancy, yeah, we should be doing that. They're young people. Teenagers are going to have sex. We said it earlier in this episode, Elizabeth. You said it. And, it's going to happen.
Well, and we need to
However,
say yeah, we
yeah,
need to say this so plainly again. The responsibility of birth control should not fall solely on women.
yeah,
We have created this situation where, like, who should we demonize? The women. Every scenario, who should we demonize? The women, right?
mhm,
Because nature doesn't miscarriages don't just happen. It must have been her fault, right? The responsibility of birth control has got to fall on everybody
mhm, yes,
involved. So, when you do things like combine birth control pills, like in your situation, you were on birth control pills for, you got on them at a young age for birth control. But, you can also, sometimes people will be on birth control pills, let's say for acne, and then they can also use condoms. I mean, there are lots of options. It's about A, knowing what they are, understanding what they are, and then creating a shared dynamic, like a shared responsibility to help if you have sons, helping them understand that it is just as much their responsibility as it is the woman's, right?
Absolutely.
It truly is. And obviously, we're talking about, heteronormative, cisgender kind of, I don't want to leave out
Mhm.
you know, but obviously that is one area that same-sex couples are not they're not using birth control pills to prevent pregnancy in that situation because they don't have the opposite gamete, the sperm or the egg that's missing. But there again, I mean, just really making it so loud and clear that it is a shared responsibility. Because in any type of intimate relationship, right, we need consent, right? We need both people to
Yes.
be consenting, and we need to teach our children about what that looks like, what that sounds like, what that does not look like, right? But when we raise our kids, A, without the shame, B, with the knowledge, and then C, with the respect to make a responsible decision. That to me creates healthier dynamics from both, a societal level, within the relationship. I think just overall to have that shared responsibility really does build a healthier dynamic overall.
Yeah,
But,
and I
but,
actually
oh, I
sorry,
was
I
just
just
going to
have
say,
one I was
do it.
gonna have a little story time here because I do know I was, again, talking to friends, a story of, you know, her son had a girlfriend, they started having sex and they were using condoms, but this friend of mine asked the girlfriend, "Hey, are you on birth control pill too?" And she was like, "No, my parents won't allow that." She couldn't have that conversation with her parents. So, my friend took her and said, "Hey, do you want to go to get birth control pills?" And the girl was like, "Yeah, I do." So, like, she took her to Planned Parenthood to get birth control pills and be checked out and everything. And, it's a shame that she was unable to have that conversation with her own family, but these are the types of things that they need to have a responsible adult or someone else that they could just at least talk to about their options. Maybe she didn't want to go on the birth control pill and it just decided not to do it. Okay, fine. That's fine too. But knowing that there are different options out there, and I think that was important. All
So,
right.
Anne-Marie, I think that you just sparked a thought for me. And that is perhaps that is, we'll say, well, when you cut Planned Parenthood funding, you're cutting access to women's health care. Yearly screening is in birth control. And you know what they're saying real quiet? Yeah, we know,
Mm-hmm.
right? Because the example you gave was of a young person that did want. And it's weird because kids turn 18 and then it's like that day all of a sudden they're adults, like that moment in time when we know that's not how it works at all. And so there's having that ability to, like we said, create a safe space, reduce the shame, increase the actual knowledge and understanding. That's neither here nor there. Let's move on.
Those, first off, birth control pill, you gotta do it every single day at the same time, like you said. Patches, you can do it weekly. Please make sure to do that. It's the same hormone combination as the pill, about 93% effective of preventing pregnancy. It's convenient, but for some people, those skin reactions, the adhesive on the patch, that can be an issue.
Yeah.
Other option is that the ring, a lot of people know it as Nuva ring. That is changed monthly. It's actually a fan favorite for a lot of people. I found a lot of people coming into the clinics and they actually liked it a lot. Again, hormone combo inserted and removed. You have a period, you put another one in, a week after your period or what, you know, follow the directions.
And as we said, like, it's simple. And so
Mhm.
anything that is simple and that you can get on a good schedule with, I think it can work. But, then we have things like the copper IUD, the IUDs, right? Those are your really heavy hitters because those guys are like 99% effective. They're long acting. You've got the copper IUD called Paragard. That one is it lasts up to 12 years. It's hormone free, but it can make periods heavier. And my own personal experience with the Paragard, I had to have it taken out. Now, I didn't know at that time that I had such severe endometriosis. I suspected it, but I didn't know for sure. and the Paragard just was like it was rough. I wanna say I had it for, like, 4 or 5 months, and I was like, "It has to be this, it has to go." So
Yeah.
that again, none of these options is going to be right for everybody. There again, we think that that conversation should happen between the patient and the provider and no one else. There are hormonal IUDs as well because of I mentioned earlier my increased stroke risk from being a migraine sufferer. Things like the Mirena, the Kylena, the Skyla. There's all these like frou-frou names for them. I guess I don't know. I find the names funny. I find the names of prescription drugs in general kind of funny. I'll like watch a commercial, and
Yeah.
be like, who thought of calling it that? Like, I wanna be a fly on the wall in that conversation. But the hormonal IUDs, those guys can last like 3 to 5 plus years and make periods a lot lighter or even disappear, which that alone can be a game changer for folks who have disruptively heavy periods.
Yeah.
Yeah.
I think a lot of, like, younger people like the IUD. I know a lot of teenagers like the IUD. Again, it's they don't have to think about taking a pill every single day and, "Oh my gosh, I forgot to take my pill," and then doubling up the next day and, "Oh, I'm feeling sick," and, "Oh, I'm having spotting because I forgot the pill," and all of those weird things that happen when you forget to take a pill.
Yeah.
So I think a lot of young people, particularly teenagers, like the IUDs. I saw a lot of them inserted during my time at the clinic. The insertion can be really rough. People think, "Oh, just suck it up." No, it really hurts. And more clinics are actually offering local anesthesia. They can lidocaine the cervix and also conscious sedation because the pain is significant and you just don't know what to expect. ASRM and ACOG, they both emphasize patient centered care, pain control during IUD placement. When, again, since I worked at Planned Parenthood, a lot of my conversations about that is going to be in this podcast because I saw a lot of Planned Parenthood.
How about that? What an interesting choice
Yeah.
for a name.
Right?
So
And
interesting.
I did a lot of sedations for women who wanted to get an IUD. They were scared about the pain or they had had an IUD in the past and they were like, "That was the worst experience of my life and I don't want to go through that." And yeah, I was in the room with them and I pushed the meds and, one of which is midazolam, also known as Versed, and it's kind of like has that relaxation effect, but it also has like an amnesia effect for some people. So,
Yeah.
it was just relaxing
They can
for
still be
them.
talking to you, but no one's home. Like,
Yep,
no,
still,
I mean,
they follow
I
direction.
mean, yes. And I'm one of those folks for whom the insertion was a horror story. It was awful. And it was diminished as if like you said, like a suck it up kind of thing, you know? And then there's other like crazy horror stories beyond just insertion, things from, them popping out to babies being born holding an IUD, like rare but memorable, right? I mean,
Definitely, I had a coworker that went to the bathroom, came back, she was holding something in in a napkin, and she goes, "Marie, look at this," and she was holding her IUD. I'm like, "Oh my gosh." She goes, "It just came out. I washed it." She did say, "I did wash it." But but I
I'm
wanted
so
to
glad
show
she
it.
clarified. Were
But
you
it
like, "I'll
was
just pop that right back in for you. Let's go
yeah,
in the
I was
exam
like
too. I could
I was
stick
like,
that right
"Oh,
in there."
man." So, the other thing that I saw a lot at Planned Parenthood, people were planning their parenthoods, was the implant, like Nexplanon. And that's also 99% effective, and it lasts up to 5 years. It's a purchase and only option, for many people who wanted the IUD, didn't want the copper, but couldn't do any of the hormonal. They chose the Nexplanon, and that people love it. It's in the arm, they don't have to think about it. Then there's the injectable birth control, the Depo-Provera injections, and they have different doses. You can do it like every month or every 3 months. You just go back in, do the injection either at your doctor's office. Although I do know people who are nurses and they just do it themselves. It's about 96% effective, but with a problem that some people have with the Depo is that it can cause menopausal symptoms. And
Yeah.
it does delay fertility return a little bit, but those hot flashes, vaginal
Yep.
dryness, those are the things that people don't like about it, but I know a lot of people that take it and they love it. The thing is
Yeah, I
that
mean, I think counseling is probably key, right? Because for
yes.
someone like me, I have POTS. It's an autonomic dysfunction where my body's not always entirely sure like how fast my heart's supposed to be beating and what my temperature is supposed to be and things like that. The Depo-Provera for me would have been like nail in the coffin because it would have all of those sort of menopausal autonomic type symptoms. In fact, I'll never forget one ASRM, speaking of, so we say that word a lot here, American Society for Reproductive Medicine, but one yearly conference I went to there was a release of a new drug, and I can't remember the name of it off the top of my head. Veoza. It's called Veoza. And it is there to help with hot flashes from pregnancy or from menopause.
Menopause.
And
Yeah.
I was like, this is awesome. So, me, I take the pamphlet and I'm like, I wonder if this would help my POTS. And so I actually
Oh.
took it to the Mayo Clinic and had like a really intelligent academic discussion with a doctor there about how drugs like that are being trialed in POTS. And so what that brings me back around to again, before we talk about like permanent birth control solutions, it brings me back around to this idea of counseling, being well aware of what your options are, having an ability to understand your risk factors with each of the options, and then make the choice that's right for you, right? Because I'll tell you, had Nexplanon been as around and as effective and as well tolerated as it is, when I was looking for birth control methods, I very well may have used something like that over the copper IUD to begin with. But then you can talk about things like permanent solutions to birth control. So, you can have your tubes tied. I tell this story sometimes. I had what was almost a life-ending pregnancy with my 7.5-year-old son, who was an IVF kid, but my pregnancy just lit my autonomic nervous system's problems all on fire. And I was very, very sick. I had home health in my house 5 days a week. It was a very difficult pregnancy. And it was an IVF pregnancy. So it was obviously one that I desperately wanted. But I knew I could never be pregnant again because I probably wouldn't survive it. So I had an elective tubal ligation during my C-section. And
Mm-hmm.
that is an option that is there. If you're done building your family, you can have a tubal ligation. Or on the contrary, if your partner is male, can have a vasectomy. But
Mm-hmm.
in both cases, it does the same thing. It blocks the highway from where the sperm and eggs live to where they're trying to go. Right. So, now I'm sure some real nerds among us be like, now, Elizabeth, a tubal is reversible. So yes, you can get a tubal reversal, but that's another that's for another day.
Yeah.
But what I do think we have to acknowledge is that the gender gap, because
Mm-hmm.
vasectomies are outpatient, they're quick, they're super low risk. That is not what a tubal is. A tubal is an abdominal surgery with a longer recovery. I mean, it's a much different ball of wax
Oh,
when you talk about blocking the highway off.
yeah. And I've seen many men, and they're like, I'm not gonna do that. I'm like, she's gonna have to go in for abdominal surgery. You can go into the office and they do the little snip snap and you're out the door, throw a bag of peas on the area, you're good to go. Right? I mean, seriously. So
Yeah.
the other thing that you see between like tubal ligation and vasectomy being a permanent solution is the women experience a lot of resistance. Are you sure? Are you sure?
Mhm.
Do you want to have more kids? What if you want to have more kids in the future? And I don't think the men are getting asked that, you know, at all. And that's an imbalance about the
No, and I
autonomy
mean, women
in
even get
reproductive
I
health
can
care.
push that one step further. I mean, I have heard stories of people in my life, women in my life who were somebody said to them once, a provider said, "What if your husband dies and you want to have more kids with someone else?" What?
What?
Come
Yeah,
again?
no.
That imbalance honestly says a
Hmm.
lot
Yeah,
about autonomy in reproductive healthcare and a lot about kind of where we're going, right? So I know we're short on time. We didn't really talk about the eSHRE. It tried to offer a less invasive option, but there were a lot of complications. That was like a
way
small
bad.
device that was put in the fallopian tubes, and we saw a lot of go wrong with that to the point where it was removed off the market in 2018. And it honestly is a really good lesson in patient safety oversight because at the end of the day, we're all like we talked about earlier. You're gonna have sex, you have to share responsibility. We all have to make sure that the the tools that we employ are ones that are rigorously tested, because certainly, the ESHRE was a great example of a method that wasn't so great.
Yeah, exactly. I think that's the biggest thing is education. It is the biggest thing that about the birth control. It's like, "Oh, yeah, here we'll put you on the pill." No. Let's talk about all the different options. Elizabeth, maybe you would have been you would have been on board with the next blonde, had someone told you about it. You might have been like, "Yeah, let's do it. Let's try that." I don't think it's talked about very much. I think everybody's first option is let's just do the pill. And then no one thinks about, oh, hey, patches. Patches are really easy. You don't want, it's weekly
Yeah.
and so on. Everything has their pros and cons, and it's just about education to that.
Yeah, and I
We
mean,
talked.
I was just gonna say, I mean, on the topic of education,
Mhm,
well, we certainly teach abstinence in school,
mhm,
right? ASRM and other organizations they all support comprehensive, age-appropriate reproductive health education. Because we talked about this before, but studies, even those coming from Columbia University School of Public Health, show that abstinence-only programs do not delay sexual activity. They only delay understanding. That's
yup,
it. So
yup,
do you wanna live in a bubble that says like, "Oh, I just won't tell my kid," and they just won't do it? Or do
mhm,
you wanna look at someone like Columbia who's run the numbers, they've crunched the numbers, they're here to tell you, it's not
yeah. Yeah, I mean, and kids need to know about their own bodies. They're vulnerable to misinformation because, we got the ticket talking. We got all that other stuff that people are looking at. I did get feedback from one of the people I spoke with, one of my friends who's a parent. Basically, she said being clueless about biology is just plain stupid. And that's it. I mean, that's the episode title right there, Elizabeth. It's done.
maybe that's the next one. No, maybe that's the next one. I mean, no, seriously though, comprehensive sex ed. We talked about this in the sex ed episode. It's very important in an episode around birth control. Comprehensive education really does foster autonomy and consent and respect. And for today's teens, I would venture to say that the stakes are even higher than they ever have been before. I mean, as one mom said to me, her son understands his partner now has less reproductive rights than they did as teens. Like, that's real world context.
Yeah, it is. That's crazy. I mean, we both live in red states. I think that in my state of Florida, anybody who has a daughter, I'm always like, I'm not going to say this directly to them, but I'm like, hope that they have them on some form of birth control or
Something.
knowledge of birth control
Yeah.
because of the state that we live in. But let's move on. And before we wrap up, we need to address access. So
Yes,
some of these
please.
options that we went over are over the counter. The prescription methods are mainly or only really for females. And insurance coverage still isn't universal. And that drives me bananas
Yep.
when I can walk into
No.
a store that when I walk into a store and I know that they fought through to the Supreme Court that they did not have to cover birth control to their employees drives me insane.
Yep. And I mean, listen, all the mainstream medical associations, the ASRM, ACOG, they advocate for contraception to be treated like any other essential medication, right? Cover it without cost barriers. Don't play games. Employers should not be dictating reproductive choices based on their company values. That's not healthcare at all. That's just control. Period.
Absolutely. You said it. There. End of story.
The
So
show's over, friends.
let's just say whether you're abstinent, you're on the pill, rocking that IUD, tracking your cycles, the most important thing is that you have made an informed and voluntary choice that works for your lifestyle.
Yeah, exactly. Reproductive autonomy means informed autonomy. That's literally the entire point of the reprofiles, you guys. I was speaking with an amazing fertility doctor on the East Coast a couple days ago, yesterday maybe, about that's the whole point and purpose of this podcast is we want to make sure that we give you all evidence and information that so you can make the right choice for you.
Yes, exactly. And share our episodes with other people too. We really appreciate everybody listening. And you can find our episode notes and references and links to because we always talk about ASRM. We're going to be there at the conference. We always are talking about it. But if you want some links, they have some really good information. So we'll be doing that in the show description.
Yeah, and if you learned something today, share this episode with a friend. Better yet, share it with a teenager in your life. Okay? Because AnnMarie and I are happy to be the truth telling aunties don't exist in their lives. Okay? Because education is prevention. So until next time, stay informed, stay empowered, and keep fighting for reproductive justice. We'll see you next time.